Hi, my name is Megan Barckert, nurse practitioner with Legacy Cancer Institute. And today we're going to be talking about reducing fatigue using a holistic approach for cancer survivors. So, a little bit about me first. I'm a mom, wife, and live out in the forest in Oregon City. Before I came to Legacy, I worked in primary care in family and internal medicine, and am now working in integrative medicine for Legacy. So, a little bit about integrative medicine. So, it focuses on the whole person and body, physical, mental, emotional, and spiritual health, uses both conventional and complementary medicine. It is evidence based. And within oncology, especially, we have a strong focus on symptom management and reducing risk for cancer recurrence. So, a little humor to get us started. So, cancer related fatigue. Here's a couple quotes from patients. People don't know what tired is until they've gone through cancer. The fatigue from cancer treatment is nothing like I have ever experienced. No amount of sleep or rest seems to help. So, cancer related fatigue affects anywhere from 80 to 100% of patients with cancer. It is much more than the common tiredness. It's an overwhelming exhaustion and weakness that doesn't go away with sleep or rest. Patients often report feeling physically, emotionally, and mentally exhausted. So, it's a completely overwhelming type of tiredness. And both the cancer disease process and cancer treatments contribute to cancer related fatigue. Severity and length of symptoms are based on a complex, wide range set of variables. So, the cancer diagnosis, the health conditions the patient has underlying, or other comorbidities, other health conditions they're coming in with, and the types of treatments they're going through all impact cancer related fatigue. And this type of cancer related fatigue can last for weeks to many months or more. So this is an algorithm just to show the different types of health conditions that can impact fatigue. So this is a very complex topic in terms of other types of fatigue outside of the cancer diagnosis and treatment. So it's a complex topic and there's a lot of things that impact it. So today we're going to focus on four topics. So these may look familiar, but when I was thinking about doing this presentation, these were all areas that have some nuance that I often find patients aren't aware of and are extremely important when it comes to this topic. So vitamin D. Vitamin D deficiency, insufficiency can contribute to fatigue and depressed mood. So alone, having a low vitamin D can cause fatigue. It's made in the skin during exposure to sunlight and is also found in foods like fish, egg yolks, fortified milk, and cereals. It's essential for bone health and supports immune health, muscle function, and brain cell activity. But the one big take home that I want to put out here is that there is research showing that vitamin D deficiency insufficiency is associated with certain cancers, including breast and colorectal. And though more research is needed on this topic, it's really important, in my opinion, that a patient with a cancer diagnosis, that we're looking at vitamin D and making sure that we're optimizing vitamin D levels. So, especially when it comes to living here in the Pacific Northwest, we do not get enough vitamin D through sunlight. And so, supplementation in our area is even more important. The Institute of Medicine recommends a daily dietary allowance of vitamin D of 600 units a day, with the upper level intake at 4,000 units daily. That being said, if you're vitamin D deficient, even 4,000 units a day is not enough to get patients to optimal levels. And when we're talking about blood levels of vitamin D, a normal level is about 30 or above. But myself and others who specialize within oncology, we often aim closer to 50 just to make sure that we're, again, really optimizing that vitamin D level. That being said, when it comes to how much vitamin D a patient should take, it's really hard to know without checking a vitamin D level first. So, in my opinion, we definitely should be looking at a blood level on labs of vitamin D so that we can optimize that level for each patient. Recovering from treatment. So, it can take many months or more to recover from cancer treatment, whether it's surgery, chemotherapy, immunotherapy, radiation therapy, and more. Some areas that are extremely important with recovery are trying to follow a plant-based diet with plenty of protein, daily exercise, quality rest, sleep, stress management. All of these will aid in healing. So, one specific topic with recovery from treatment I wanted to highlight today was anemia. So, anemia occurs when the body doesn't have enough red blood cells or hemoglobin to carry oxygen. It can cause significant fatigue and other symptoms like lightheadedness or shortness of breath. But the big take home here is that I often have questions from patients when they see that they're anemic on labs about whether they should take supplementation of like iron or B12. But when it comes to treatment, anemia that's caused from surgery or chemotherapy, often it's not related to an iron deficiency or a B12 deficiency. So normally for a lot of these types of anemia, it's not necessary to be taking supplementation because the B12 and iron aren't the issues causing the anemia. It's parts of treatment that are. That being said, eating foods rich in iron and B12 can help build new red blood cells. So foods that have both of those in high amounts are poultry, shellfish, eggs, soy, spinach, fortified dairy, and cereals. So, it still could be very reasonable to take like a multivitamin with iron, but even that, I recommend speaking with your oncologist or other provider on part of your team within the Cancer Institute because more is not always better. And there are parts of treatment where taking additional unnecessary iron or B12 supplementation may affect outcomes. So definitely check with your provider first. Sleep. So it is really important if you're having any types of sleep disturbances that we look at other health issues that could be impacting any kind of sleep issues. So whether it's anxiety, pain, restless leg syndrome, obstructive sleep apnea, and that's just a small list of the different health conditions that can contribute to sleep disturbances at night. Medications can also impact sleep, including steroids, which are often given during treatment, antidepressants, and pain medications. When it comes to improving sleep, so we should be looking at these different issues and trying to work on reducing them with treatment options. But it's also really important for us to look at patients' environmental and behavioral areas that we can change when it comes to sleep, because that's often where we're going to find the greatest impact when we're going outside of other conditions or medications that may be impacting sleep. Uh, Specific to those that have chronic sleep disorders like insomnia, cognitive behavioral therapy programs have been found to be very effective for chronic sleep issues, and those can often be found through sleep medicine programs. So, when it comes to sleep disturbances, once I've looked at other health conditions and medications that can impact sleep, working on sleep hygiene or sleep environment and behaviors around sleep with patients is usually the most important thing I can do to help them improve their sleep. So, areas that are important with this: regular exercise, healthy diet, stress management, those are all really important. It's also important to really try to have a consistent bedtime and waking time and creating a routine before bed, such as dimming the lights as it gets closer to bedtime, avoiding screens for 1 to 2 hours. You don't want to exercise too late in the evening. So often I'll say before 5 p.m. Because that will affect the sleep wake cycle as well. Really, we're just trying to cue the brain that it's time to be getting ready to go to sleep. It's also important to minimize napping during the day if possible, and really look at your caffeine and alcohol intake. Alcohol can impact the sleep wake cycle. And one of the big things here that often I find patients are unaware of is that as we age, caffeine, the way the body metabolizes it, it can take longer and longer. So with patients who are a bit older, caffeine can stay in the body for 24 hours. So even one cup of coffee first thing in the morning can impact sleep that next night. So it's just something that I make patients aware of in case there's changes there that might be beneficial for them. It's also important to reserve the bed for only sleep and sexual intimacy. So ideally, I want the brain to associate nothing with the bed except for sleep and sexual intimacy. So that means not being awake in bed, not reading even a paper book in bed, not using screens in bed, or doing anything else in bed. And in terms of the awake piece, we really don't want our brain to associate the bed with wakefulness. So if patients are awake for 10 minutes or more when they're trying to fall asleep, or if they wake up during the night and are awake for 10 minutes or more, I recommend getting out of the bed, keeping any lighting low, avoiding screens, avoiding visual stimuli, including reading a paper book, and do something relaxing. So get out of bed. You can stretch, meditate, do yoga. I empty my dishwasher at night some of the time. And then when you're tired, return to the bed again. And if you're not asleep for another 10 minutes, then when you get out of bed again, and so on until you're sleeping. And at first, this can be a bit maddening, and I'm aware of that. But it can retrain the brain to sleep through the night. Sometimes during treatment, it is not the optimal time to be really aggressively working on this, but these are huge. There's just huge benefits to improving sleep quality by doing environmental changes like this. So, sleep and supplements. This is a huge topic with my patients when it comes to sleep disturbance. So, supplements have side effects and can interact with medications. So, I always remind patients that it is really important, especially during treatment. And I can't highlight that enough, that we talk with your provider before starting one. Supplements are, they're not benign, meaning they have risks and they have side effects. And so we really need to make sure that they're safe to use during treatment, especially. In my experience, when it comes to supplements for sleep, they can help you fall asleep, but they usually won't keep you asleep. They're not strong enough to get patients to sleep through the whole night, in my experience. But if falling asleep is the main issue, then they can be useful. And so, two supplements I'll often use is L-theanine, which is derived from tea, and a type of magnesium, such as magnesium calm. Again, I recommend talking to your provider before starting even one of these, especially during treatment. But these can be helpful in terms of just getting patients to feel relaxed in the evening and helping fall asleep. There are many other supplements used for sleep, but the evidence is really limited in terms of their efficacy. So again, I really highlight the importance of the environmental factors when it comes to improving sleep quality. Um, and then cannabis. So cannabis or marijuana and sleep. This comes up a lot with my patients. The research is limited and it's mixed. So there is evidence out there that say that marijuana actually may reduce the quality of sleep during the night. And then I have lots of patients who say, gosh, no, it really makes a difference for me. And then others who say it doesn't. So, again, the most important piece here for me is that you check with your provider first before trying it for sleep. Often, if it's deemed safe, it's one of those things where I'll tell patients, well, you can try it. And we talk about how to do that safely, and just see if it makes a difference, if it's helpful for them or not. Mental health. So, this is a huge area with my patients when it comes to fatigue. So, when it comes to the moment of a cancer diagnosis, all kinds of areas, including struggling with stress, depression, anxiety, are extremely common and they can cause fatigue. Changes in diet, exercise, and sleep can really make a difference. And so, again, that those lifestyle pieces are huge when it comes to improving things like sleep quality, which then links to mental health areas like anxiety and depression. So, research has continually shown exercise to be as, if not more, effective than other treatments for stress, depression, and anxiety. So, exercise is an area that I really try to highlight with my patients. And when I say exercise during treatment, we're talking walking. So, I'm not saying, really high levels of intense exercise during treatment, but movement is so important. And though research has found higher intensity exercise to be the most helpful, even 5 minutes of walking a day makes a difference. And so, whether it's walking around your house, doing a loop around the block, I just try to get my patients moving because it really does make a huge impact on mental health and other things like sleep quality, which all link in to the issue of fatigue during treatment and beyond for that matter. So, therapy, when it comes to mental health and that link to fatigue, therapy is also something that can be extremely useful, and research has found it to be so. Talking to someone other than friends and family can often offer much needed support during cancer treatment and beyond. So, though patients often will say, "Oh, I've got friends to talk to, I've got family," in my experience, it can be really useful to have someone outside of those people to offer an objective ear and just be there to give that additional support. So, one particular area of therapy that's been found to be the most effective is cognitive behavioral therapy. So, it's used by many mental health professionals. And when looking for a therapist, I really recommend looking for one that does cognitive behavioral therapy due to the efficacy it's been found to have in research. When looking for a therapist, I also recommend asking if you can have a brief conversation by phone. So it can even just be a few minutes, but it really can make a difference in terms of seeing whether or not it's going to be a good rapport with the therapist. Often I hear from patients, "Oh, I've seen a therapist before. It didn't work for me. It didn't go well." And my next question is, "Well, did you like them? Was there a good relationship with your therapist?" And usually the answer is no. So even that really brief conversation can be helpful to see if it's going to be a good fit. And ideally, that would happen when you're kind of going through the screening process of finding a therapist, because you don't want to be on a wait list for a month or more and then have your first visit and then find out, gosh, this is just not going to work. In addition to therapists, we have wonderful social workers through Legacy, through our Cancer Institute. So if you're having trouble finding a therapist or other mental health support, our social work team is great. And so they're a great resource in terms of helping find that assistance. So I always mention that to my patients. And then in house at the Legacy Healing Center where I work, we also have a wonderful psychologist, Dr. Michelle Lee, and she meets one on one with patients here in our healing center at Good Samaritan. And we also have art therapies. We have two art therapists in house, as well as they do individualized and group art therapy. So, in terms of art therapy, there's mindfulness aspects to it, working on coping mechanisms, and then just working on art or, painting, whatever it might be, can be very therapeutic to just slow the mind, bring you back to the present, ground you, and stop some of the worry and the other persistent thoughts that can happen, especially during treatment. So that kind of leads into mindfulness and meditation. So there is just a plethora of research showing the benefits of mindfulness and meditation when it comes to mental health. And again, I'm linking this to fatigue because the two are so interrelated. So in terms of that, I often will give patients, UCLA has some great guided meditation. So this is their website for that. And, patients often say, "Oh, I can't meditate." But these are 3, 5 minutes long. So they're short. And so I feel like that makes it a lot more doable for a lot of folks to at least give it a try and see whether or not it's something that might be of benefit for them. Here's a simple breathing exercise I call one breathing, that I'll have patients do. So just breathing in through your nose, out through your nose slowly. And when you breathe out in your head, you say the word one. You can pick a different word, but the idea again is to try and ground into the present, quiet the mind. You can do this pretty much anywhere, and it's just another way to kind of stop for a moment and try to stop that stress response that happens when we're dealing with moments of anxiety or stress. And then Legacy also has wonderful, a whole different array of free classes. So we have yoga, tai chi, forest bathing, gone meditation, qigong, lots of different offerings that are online. We're starting to have a little bit more in person. So this is a link to all of our offerings there. So just lots of other areas there to help with stress management, feelings of anxiety, depression, whatnot. So, when it comes to mental health, medications are a big topic. So, there are many types of medications that can help with mental health conditions. So, if we're talking about like anxiety or depression, and those include antidepressants, but I do like to mention that those are not all there is. So, there are other options outside of antidepressants that can be very useful during treatment. And these are areas that I discuss one on one with patients depending on the situation and the patient in terms of what might be helpful. Antidepressants, so they are very effective when it comes to treating many symptoms other than anxiety and depression. So they can be helpful with hot flashes, neuropathy, which is nerve pain, chronic pain, insomnia. So there's a lot of benefits to them outside of treating mental health conditions like anxiety and depression. So when I have a patient who is struggling with both mental health and some of these symptoms, looking at a medication to add into the treatment plan can be a really great idea. So, side effects from antidepressants. So, this is one area I get a lot of resistance or concern from patients about trying one because of side effects. So, in my experience, if we're very careful about selecting the antidepressant and we start out slow and low in terms of starting at a lower dose and looking at the time of day that you're taking the medication and other factors, we really can limit side effects that patients experience. And when we're talking about lower doses and starting out slow, this can be done relatively easily. And if patients are struggling, we can always take them off the antidepressant. So it's not like you start it and you have to commit to it full force without seeing what's going to happen. So there's a lot of options here, and they just can be really useful. And so, it's not right for every patient, but I just really wanted to highlight this because I think it's an area that I have found to be so helpful for a lot of my patients, especially those that are coming in with mental health conditions prior to starting treatment. So those that have maybe struggled with anxiety or depression for a long time, and then they so happen to have some of these symptoms in addition. And so, with those types of situations, this is a really valuable area to consider. So, beyond the topics that we just spoke about, there's a lot of other resources at Legacy. And so I wanted to highlight those. So, speech therapy, we have wonderful speech therapists at Legacy, and they are wonderful to help with symptoms of brain fog or chemo brain. We often call it like slowed cognition. So, they've got exercises they can help patients with to help retrain the brain to kind of get back up to speed after treatment. So that's a resource I always discuss with my patients who are struggling with symptoms like that. Physical therapy can also be wonderful when it comes to regaining strength and mobility after treatment or surgery, etc. So, they can help identify areas of weakness, tightness, give you specific exercises to work on at home to help you get back to baseline or near baseline where you were before starting treatment. We also have dietitians on staff, and so they can help recommending meals, diet plans, give ideas for specific diets or other dietary changes, answer specific questions. So they're a wonderful resource when it comes to trying to get diet back on track, moving forward, and dealing with symptoms of fatigue. We also have a clinical pharmacist on staff. So she's a wonderful resource in terms of looking at a patient's current medication list, looking for possible medications that may be contributing to fatigue, and just identifying any possible areas of improvement within a med list or drug interactions, etc. And then I wanted to really highlight here as well that it's really important to maintain a relationship with your primary care provider. One of the main reasons this is so important is that algorithm I showed you at the beginning of this talk about all the areas that contribute to fatigue. So there's a huge amount of them. And especially once you've gone through treatment or during treatment, a lot of different aspects of treatment can impact other health conditions. So either they can worsen them or they can create a new problem. And those that we often see impacted during treatment include thyroid dysfunction, diabetes, blood pressure management, where blood pressure is either too low or too high, chronic pain. Long COVID is a big topic now that we've gone through the pandemic in terms of that effect on fatigue and many other symptoms when it comes to treatment. So it's so important to have that relationship with your primary care provider or to reestablish it once you're through treatment to make sure that we're not missing any areas that might impact you in terms of fatigue. And then these are my references for the talk today. And one last thing I wanted to highlight before we end is acupuncture. So I didn't mention acupuncture in this talk because within the research, it hasn't been found as effective for symptoms like fatigue or mental health. but it has great benefit. And so I don't want to leave that out entirely. It's something I always talk to my patients about, and it's another area that can be really useful for all kinds of different symptoms during treatment and afterward. All right. Well, thank you for your time, and I hope you have a great rest of your day.